Dr. Michael J. Mirro joins us from Fort Wayne Cardiology, where he specializes in the field of cardiac electrophysiology and clinical research. He has served as the principal investigator in over 100 clinical trials over the course of the past 30 years. Dr. Mirro has held leadership positions in the American College of Cardiology, the Heart Rhythm Society, and he is the founder and medical director of Parkview Research Center. His topic today is the use of PHR to engage patients post-coronary revascularization. So please help us welcome Dr. Mirro. Thanks for being here.
Thank you. Can you hear me okay here? Well, thank you. We're going to shift gears again to patient engagement, which was the first talk this morning, and you can see here at this wonderful theater, and right behind you we have a significant display about patient engagement,
Dr.
and there's
Carol,
some materials there
follow me.
that are very helpful.
We'll get you wired up.
I have a personal interest in electronic health records and information technology and how to transform healthcare. I've been involved with a number of different committees in that regards, ACC, Heart Rhythm Society, but also the National Quality Forum. So over the years, I've been very impressed that there is a growing need for electronic tools to engage our patients in their care. And obviously the federal government understands that to a significant degree, and that's why the meaningful use criteria, particularly phase 2, are going to require physicians to use a personal health record. Just a little bit, I'm a practicing cardiologist. There's 23 physicians in our group, and I practice EP full-time for the last 30 years. And we've had an electronic health record since '99, and our enterprise system is going to be Epic in 2012, which we're going to change over to. This is where I practice healthcare. We just moved to a new heart institute. So what we're going to talk about is patient engagement, the role of the electronic personal health record, ePHR, the role of regional health information exchange and how to enhance the use of the PHR. We've partnered with a commercial partner, No More Clipboard, who was able to get a grant, a Beacon Challenge grant through ONC to fund a study on patient engagement and using PHRs. And that study is called ePHR Indiana throughout the state. And our local study is the use of a PHR looking at coronary revascularization and patient outcomes. So let's just do a little overview of PHRs. The principles of patient engagement through the Markle Foundation. Individuals should be able to access their health and medical data conveniently, authorize other people to access the data, designate someone to have access. It should be easily understood information. And electronic health data exchanges must protect the integrity and security of this data. Independent bodies accountable to the public should oversee a nationwide electronic health information exchange. So in that regard, a lot of the stimulus money, many of you may know, went to the states for health information exchange to enhance information exchange at the local level. And a large part of this will now start to trickle out with regards to engaging the patients with electronic solutions. And the personal health record, or PHR, the definition is here, an electronic application which individuals can access, manage, and share their information in a private, secured environment. Internet-based set of tools that allow people to access and coordinate their lifelong health information. And then that information is shared electronically with the other providers that are on taking care of that patient, and the patient is in control. That is what we would term an untethered PHR. Historically, personal health record, I mean, if you think about it, a medical alert bracelet is in some respect is a personal health record, not electronic. Today, about 7 million people have some form of PHR where they store their data either analog or digitally. There are broad ranges of types, but really what we want to talk about today is the PHR that's integrated with electronic health record, where we can bidirectionally message patients. And typically that's done in what we call a tethered environment, where the PHR is actually part of the vendor platform for the EHR. The problem with the tethered PHR, though, patients see different physicians, they have different electronic health records, it is not as portable, so an untethered PHR is the ideal solution. Of course, the benefits improve patient access to all their information remotely. So if your patients are quite mobile, which our patients are mobile these days, if they're in Florida or California and they live in Minnesota, they can have all of their information available in their care providers. Approved ability of patients to collaboratively track their chronic diseases and to timely message patients with communications about their disease to help manage their disease, send them timely educational information. More data, of course, assists clinicians to make improved decisions and enhance patient safety and empower patient-provider communication. So a tethered PHR, which I refer to as probably the model that you're most familiar with. Many health systems have a portal where patients put information in. It's usually very static in that respect. It has limited functionality. There are more robust tethered PHRs, such as the one that a vendor called Epic has, but it's typically institution-specific, web-based, limited forms of integration with the EHR. Patients have access to part of their electronic records. It will allow email and follow-up appointments and scheduling. This is actually very important for provider efficiency, and patients love to be able to schedule their appointments and get their prescriptions refilled electronically. The disadvantage is if it's a tethered product, it may not reflect the entire patient health record because the patient is going to other locations for care, different ERs, different healthcare providers, and you really want all of the medical information in that patient's personal health record. So the early experiences, and many of you may have had experiences with PHR. Epic, which I refer to, has a product called MyChart, where patients, for example, Cleveland Clinic uses this quite a bit. That's their personal health record that the patients use. Patients put information there. It's messaged to the provider. The provider can message the patient and remind them about certain things that they need to be aware of, particularly if there's new information about their disease they're managing. Beth Israel has one, Children's Hospital in Boston. Many of these have had limited functionality and benefit. However, the MyChart, the Epic system, probably is the one that's been the most tested because Kaiser in California has had it. They've had 30 million people on that PHR system. The nice thing about using PHRs, a fully functional PHR, is you can connect it with home monitoring systems. And again, I want to encourage you to visit the booth behind us here. They have some great examples of home monitoring tools for heart failure care, for example, and you can have that information follow through the PHR, and now, of course, that is messaged then to the physician's electronic health record. The product that we're using in our study, we can also message the other providers both electronically, and if for some reason they don't have an electronic health record, we can actually fax the information to them. So it's actually very good that the patient has the ability to enter information that can be use multiple modes of transferring that information to all of the physicians involved with their care. And of course, the linkage to education is really important. Building health literacy, links to decision support for the patients, single source of living wills and advanced directives, and it also, as the CardioSmart physician articulated, health-related social networking is also a big future trend where patients with the same chronic disease can share stories about their disease and their management. Well, this is all really interesting and important, but how are we going to get information between different systems? Well, Regional Health Information Exchange is the answer. In Indiana, we have a very robust environment of health information exchange. Across the country, this has been very uneven, and the success of these have been very, very difficult to sustain. But what really has changed everything, of course, is the stimulus package, and that part of the stimulus package, high-tech, which then provided, even in phase one, some level of patient engagement. And here's the meaningful use menu set for phase one. which includes sending reminders to patients for preference for preventative follow-up care and providing patients timely electronic access to their health record within 4 business days. So that is part of adherence to meaningful use. So I don't know how many of you have already attested for meaningful use phase 1, which you should be doing right now. So you should be doing this right now in order to receive the stimulus money in 2012. You need 90 days of adherence to be able to do that. So I'm going to tell you a little bit about, we received grant funding for a study with No More Clipboard, which is the commercial product that is used to provide electronic personal health records to various areas of the state of Indiana to actually stimulate consumer-mediated health information exchange through our statewide health information exchange and demonstrate bidirectional messaging. So this, going back to the meaningful use, this is where we are right now. In 2015, phase 2 will require a very high level of patient engagement, which is going to require significant use of personal health records. So ONC, because of all the funding, is certainly carrying the big stick, and then later there are penalties that follow after 2015. And there's a variety of ways that they've tried to fund the uptake of electronic health records. And as you know, the stimulus package is part of that. They also funded what's called a Beacon Community Program, which are grants for specific areas of the country to try to be a beacon, if you will, of best practices for health information exchange. The state of Indiana, we have a Beacon grant. The states have set up health information exchanges, and the state of Indiana, for example, got $32 million to do this. Many of you are maybe aware of how much money your state received. And then there was a challenge grant, a Beacon Challenge Grant program, and what I'm talking about with PHRs, we've received funding through the Beacon Challenge Grant program to demonstrate the value of personal health record deployment. So the idea pre-grant was health information exchange in our state. We have 5 regional health information exchanges, and it's the center of it is the providers and the hospitals. But the future is with meaningful use, like meaningful snow, we want the patient to be at the center of that, to utilize these technologies, and the patient should be at the center of the health information exchange. So this is what we believe, not just myself, but also ONC, that the patient and the physician as a team, the patient-physician being engaged, is at the center of health information exchange. So this is the title of our grant. PHR is a set of computer-based tools that allow people to access and coordinate their lifelong care. Shown here is the outline of the ePHR Indiana, where different areas of the state, we're utilizing the MedWeb, which is our health information exchange, and PPG Cardiology is my professional group, and there's a neurological center that's involved with this. In Bloomington, getting over the loss from last night, we have these different participants with health information exchange. Different areas of the state are demonstrating health information exchange. What we're doing is measuring at the beginning of the study the level of patient engagement. There's a patient activation measure. It's a survey the patients fill out, and actually you can measure scientifically their level of engagement. But also, we're measuring their internet literacy and their ability, their technology acceptance. So at the beginning of the study, they're going to fill out this, and then providers are also going to fill out this, and we're measuring this at different time points. So we wanted to also study this as a cardiologist in a very specific application. The application is the use of this for patients after stenting. So shown here is our cardiology group. Patients who have had a stent or bypass surgery are entering the study. We evaluate the impact of the PHR intervention on their outcomes. This is actually what the personal health record looks like. Patients go into our portal. There's a registration form they fill out electronically. This is what it looks like. A screenshot from a patient who's de-identified with their problems and their medications. Shown here is a patient is entering data, which is in message to us. So we do have the ability then to receive blood pressures electronically from the patients and other data. So the thing is, a lot of...
You want a PHR? I think I'm entitled to one. You want a PHR? I want the truth! You can't handle the truth.
So a lot of vendors, you know, are trying to beat doctors over the head to use these PHRs. And, you know, they're very aggressive. And the future of PHR use, we believe, is actually not just surveying patients and having them message, but also to look at medication compliance. So our next phase, which we're involved with this, is not only to look at the outcomes of these patients, but to integrate lessons from the pilot project. We're targeting medication compliance, online prescription refills. We think this is going to be a great opportunity to document medication compliance, particularly after coronary intervention. And so phase 2 is really focusing on the problem of medication compliance. 50% of patients with heart disease are not taking their life-saving medications. All of us know that. We need more aggressive tools to engage our patients, such as this. We're also designing another trial focusing on atrial fibrillation for that very reason. Very high impact disease, high cost, high need for patient engagement, many new drugs, anticoagulants specifically. Patient compliance is critical. New therapies to maintain sinus rhythm, including ablation, high risk for stroke and death in this disease, and there's a lot of non-compliance. So with that, I'm going to finish up. Thank you for your time. Hope you found this enlightening. Thank you.
Thank you so much, Dr. Mirro. It appears we do have just a couple of minutes. If we have any questions, I've got a microphone here that I can get to you. Does anybody have a question for Dr. Mirro? I saw a waving hand. Back here? Sure. There you go.
Hi, Dr. Mirro.
Hi.
My name is Ivan Anderson. I'm a research fellow at UC Davis. So how are you ensuring patient compliance with your PHR? And does it integrate with your larger EHR like Epic?
Great question. So currently, our ambulatory electronic health record is called WebChart. We have now flipped over to Epic, and this product will directly electronically enter the patient data into our record. But there is a we can see the data coming in, but the physician or nurse has to okay the data entering, because patients can put some crazy stuff in. You know, as you know, the wrong dosage, wrong drug, drugs that don't exist, and so we do have that ability to make sure that the data that's going into their permanent electronic health record is indeed valid. So that's the first thing. Secondly, as far as measuring their compliance, we're going to utilize, and so that's the second phase where we're going to look at medication compliance. What we're going to be able to do is, working with SureScripts, we can see the refills that are taking place on a timely basis. It is not as good as a pill count, for example, in a clinical trial, but it's probably the best thing electronically that can be done that's seamless and actually make sure, for example, the patients post-stenting are taking their Plavix or getting their Plavix refilled on a timely fashion. And by using that electronic tool, we can actually also message the patient through their smartphone, say, Mrs. Jones, we see that you did not get your Plavix refilled. You're ready to get your Plavix refilled. Get your Plavix refilled. Your stent's going to cloud off. You know, so it's actually these electronic tools, I think, are the future of how we're going to manage our patients.